7 most critical symptoms of colon cancer. Imagine waking up one day feeling a little bloated. Maybe your stomach has been acting up lately, or you've noticed a slight change in your bowel habits. You shrug it off, thinking it's just something you ate. But what if these small, seemingly harmless changes were actually the first warning signs of colon cancer? Many people ignore the early symptoms until it's too late. Colon cancer is one of the deadliest cancers worldwide, yet it's also one of the most preventable. When caught in its early stages, the survival rate is over 90%, but if it goes undetected, it can silently spread, leading to devastating consequences. This disease doesn't discriminate. While it's more common in people over 50, younger adults are also being diagnosed at an alarming rate. The worst part? Most people don't realize they have it until symptoms become severe. In this video, we'll uncover the 7 most critical symptoms of colon cancer, the ones you need to watch for before it's too late. Some of these signs may seem minor, even normal, but if they persist, they could be your body's way of warning you about something serious. Colon cancer, also known as colorectal cancer, starts in the large intestine, colon or rectum. It often begins as small, non-cancerous growths called polyps. While most polyps are harmless, some can slowly turn into cancer over time. At first, colon cancer doesn't cause noticeable symptoms, which is why early detection is crucial. Left untreated, it can spread to other parts of the body, making it much harder to fight. While anyone can develop colon cancer, certain factors increase your risk. Age plays a significant role, with most cases occurring after 50, though younger diagnoses are becoming more common. Family history and genetics also contribute. If a close relative has had colon cancer, your risk is higher. Lifestyle factors such as a diet high in red meat and processed foods, excessive alcohol consumption, and a lack of fiber can elevate the likelihood of developing the disease. Additionally, smoking and obesity significantly increase cancer risk. Colon cancer is highly treatable when caught early. Don't wait until symptoms become unbearable. Know the warning signs and act fast. Stay with us as we reveal the 7 most critical symptoms you should never ignore. 1. Persistent changes in bowel habits. One of the earliest and most common signs of colon cancer is persistent changes in bowel habits. While occasional digestive issues are normal, any significant or long-lasting alteration in the way your body processes waste could be a red flag. Changes in bowel habits can include diarrhea, constipation, or a noticeable narrowing of stool that persists for more than a few days. Unfortunately, many people overlook these symptoms, assuming they are caused by diet, stress, or minor infections. However, when such changes become frequent, persistent, or unexplained, they should not be ignored. Before understanding abnormal bowel habits, it's essential to know what a healthy bowel movement looks like. While there is no single, perfect pattern for everyone, a normal bowel movement typically occurs anywhere between 3 times a day to 3 times a week. The stool should be well-formed, medium to dark brown in color, and easy to pass without excessive straining or discomfort. Additionally, a person should feel a sense of complete evacuation after going to the bathroom. The digestive system is influenced by various factors, including diet, hydration, activity level, and overall health. Minor, temporary fluctuations in bowel movements can be caused by eating a new type of food, traveling, or mild stomach viruses. However, when irregularities last longer than a few weeks and become a consistent problem, it may be a sign of something more serious, including colon cancer. Occasional diarrhea is common and usually linked to infections, food poisoning, or dietary changes. However, persistent or unexplained diarrhea that lasts for more than a few days or weeks can be a warning sign of colon cancer. In some cases, colon cancer can irritate the lining of the intestine, leading to frequent watery stools. This occurs when a tumor obstructs the normal absorption of fluids in the colon, causing loose stools or urgent bowel movements. Individuals may also experience a feeling of incomplete evacuation, where they feel the need to go again immediately after using the bathroom. Chronic diarrhea can also lead to dehydration, weakness, and nutrient loss, further weakening the body. If diarrhea is persistent and accompanied by blood in the stool, unexplained weight loss, or stomach pain, seeking medical evaluation is crucial. On the other end of the spectrum, chronic constipation can also be a warning sign of colon cancer. Constipation is defined as having fewer than 3 bowel movements per week. difficulty passing stool, or a feeling of incomplete evacuation. While constipation is often caused by low fiber intake, dehydration, lack of exercise, or stress, persistent constipation, especially in individuals who previously had regular bowel habits, could indicate a blockage in the colon. A tumor growing inside the intestine can slow down or obstruct the passage of stool, making bowel movements more difficult. In some cases, constipation may also cause abdominal pain, bloating, and nausea, which can worsen over time. If constipation becomes frequent, severe, or long-lasting, it is essential to seek medical attention. A sudden change in stool shape, particularly if it becomes narrow or ribbon-like, can be another concerning sign. Normally, stool maintains a consistent shape and size, influenced by the width of the intestine. However, if the stool becomes thin, pencil-like, or consistently narrow, it could indicate that something inside the colon is blocking the passage of waste. A growing tumor can partially obstruct the bowel, reducing the available space for stool to pass through. Over time, this narrowing can become more severe, leading to complete blockages which can be life-threatening. While other conditions, such as irritable bowel syndrome, IBS, or hemorrhoids, can also cause changes in stool shape, persistent stool narrowing that doesn't resolve should never be ignored. If accompanied by blood in the stool, unintentional weight loss, or ongoing abdominal pain, it warrants immediate medical evaluation. Many people dismiss bowel changes assuming they are caused by diet or minor digestive issues. While this is sometimes the case, persistent or unexplained changes lasting more than a few weeks should always be checked by a doctor. Early detection of colon cancer significantly improves treatment success and survival rates. If you notice persistent diarrhea, chronic constipation, or narrowing of the stool, consider keeping a symptom diary to track frequency, severity, and any accompanying signs. Discussing these details with a healthcare professional can help them determine whether further testing, such as a colonoscopy or stool test, is necessary. 2. Blood in stool or rectal bleeding. Seeing blood in your stool or experiencing rectal bleeding can be alarming, but many people dismiss it as something minor, such as hemorrhoids or a small tear. While those conditions are common and often harmless, persistent or unexplained bleeding can also be an early warning sign of colon cancer. Recognizing the difference between harmless causes and potential danger is crucial. If blood in the stool is ignored for too long, it could allow a serious condition like cancer to progress undetected. Colon cancer often begins as small polyps in the lining of the colon or rectum. Over time, some of these polyps can become cancerous, leading to ulceration and bleeding. As the tumor grows, it may disrupt the surrounding blood vessels, causing blood to leak into the digestive tract. This blood may appear in different ways depending on where the tumor is located in the colon. Bleeding from colon cancer can be gradual and intermittent, meaning it might not always be obvious. This is why people sometimes ignore mild rectal bleeding until it becomes more severe. However, even small amounts of blood in the stool can be a red flag that shouldn't be ignored. The color and appearance of the blood in your stool can provide important clues about where the bleeding is coming from. Bright red blood, known as hematochezia, typically originates from the lower part of the digestive tract, such as the rectum or lower colon. It may appear as streaks of fresh blood on toilet paper, in the toilet bowl, or mixed with stool. While hemorrhoids and anal fissures can cause similar bleeding, persistent or heavy rectal bleeding requires medical evaluation. On the other hand, dark, tarry stools, known as melena, usually indicate bleeding higher up in the digestive tract, such as the ascending colon or stomach. Blood from these areas is partially digested, giving it a black or tar-like appearance. Melena is often a sign of significant internal bleeding, which can be serious and requires urgent medical attention. In some cases, blood in the stool isn't visible to the naked eye. This is called occult bleeding, and it can only be detected through a stool test. Occult blood is often a silent warning sign of colon cancer, as it can go unnoticed for months or even years. Regular screening tests, such as fecal occult blood tests, FIC, or fecal immunochemical tests, FIT, can help detect this hidden blood before symptoms appear. Blood in the stool by itself doesn't necessarily mean cancer, but when combined with other symptoms, the risk increases. Be especially cautious if rectal bleeding is accompanied by unexplained weight loss, persistent changes in bowel habits, abdominal pain, or fatigue and weakness, which may indicate anemia. If you notice blood in your stool along with these symptoms, don't wait. Seek medical advice immediately. Not all cases of rectal bleeding are due to colon cancer. Some common, less serious causes include hemorrhoids, which are swollen veins in the rectum that can bleed during bowel movements, and anal fissures, small tears in the anus that cause bright red bleeding. Other possible causes include diverticulosis, which involves small pouches in the colon that can become inflamed and bleed, and inflammatory bowel diseases IBD like Crohn's disease or ulcerative colitis, which can cause chronic intestinal bleeding. While these conditions are not cancer, it's important to rule out more serious causes through proper medical evaluation. Many people assume that rectal bleeding is due to hemorrhoids or diet issues, but if bleeding persists for more than a few days, a doctor should be consulted. Seek medical help if bleeding continues for more than a week or recurs frequently, if blood in the stool is dark, black, or tarry, or if you experience dizziness, fatigue, or signs of anemia, such as pale skin or shortness of breath. Bleeding, accompanied by unexplained weight loss or persistent abdominal pain, is another red flag that requires urgent medical evaluation. A doctor may perform tests such as a colonoscopy, sigmoidoscopy, or stool tests to determine the cause of bleeding. If colon cancer is detected early, treatment is much more effective. Seeing blood in your stool can be frightening, but ignoring it can be far more dangerous. Whether it's bright red, dark, or hidden, rectal bleeding should always be taken seriously. While there are many possible explanations, persistent bleeding could be an early sign of colon cancer. Early detection saves lives. If you notice blood in your stool, don't dismiss it. Get checked, because catching colon cancer early could mean the difference between life and death. 3. Unexplained weight loss. Unexplained weight loss is one of the more concerning symptoms that can be associated with colon cancer, often occurring gradually and without any noticeable changes in diet or physical activity. It's important to pay attention to any significant weight loss that happens without an obvious reason. In many cases, individuals with colon cancer lose a noticeable amount of weight, sometimes even before other symptoms appear. This weight loss can be subtle at first, but over time, the person may begin to notice their clothes fitting more loosely or the number on the scale dropping unexpectedly. While weight loss can be caused by a variety of conditions, when it occurs in conjunction with other warning signs, such as changes in bowel habits or abdominal discomfort, it should be taken seriously. The mechanisms behind weight loss in colon cancer are multifaceted. As the cancer grows, it can release chemicals that alter the body's metabolism, leading to an increased energy expenditure. These changes in metabolism cause the body to burn more calories, even when a person is at rest, leading to weight loss. Additionally, tumors can partially or completely block the intestines, preventing proper digestion and nutrient absorption. Even though a person may be eating normally, their body may not be able to use the food effectively, resulting in malnutrition and further weight loss. Colon cancer can also lead to discomfort from abdominal pain, bloating, or nausea, contributing to further weight loss. Colon cancer can also cause intestinal inflammation, which can make eating difficult and result in nausea or even vomiting. This is another reason why individuals may not feel like eating, thus causing further weight loss. Moreover, as the tumor develops, it can lead to chronic issues like diarrhea or constipation, which can worsen nutrient absorption and make it harder for the body to maintain healthy weight. These issues interfere with the normal digestive process, making it harder to absorb essential nutrients that the body needs to maintain energy and weight. When weight loss occurs due to colon cancer, it is often a sign that the cancer is progressing and the body is starting to struggle with its ability to function normally. While the rate of weight loss can vary, losing more than 5% of body weight within a few months without a known cause should be a red flag. For example, a person who normally weighs 150 pounds, losing 7-8 pounds, without any clear explanation, could be experiencing something more serious than just normal fluctuations. Colon cancer weight loss may not always happen in one dramatic drop, but can occur over time, steadily taking a toll on the individual. The weight loss becomes especially concerning when it is accompanied by other symptoms like persistent abdominal pain, blood in the stool, changes in bowel habits, or fatigue. These combined symptoms should prompt an immediate medical consultation. Colon cancer is more treatable in its early stages, and recognizing it before it advances is key to improving outcomes. If you're experiencing unexplained weight loss with other gastrointestinal or general health symptoms, it's essential to consult a healthcare provider for further evaluation. While colon cancer is one possible cause of unexplained weight loss, it is important to remember that weight loss can also result from many other health conditions. Some common causes of unexplained weight loss include thyroid disorders such as hyperthyroidism, where the thyroid produces too much hormone, and chronic infections like tuberculosis or HIV/AIDS. Other conditions such as gastrointestinal diseases, mental health disorders like depression, or even diabetes can also lead to weight loss. Therefore, if you notice unexplained weight loss, it's crucial to seek medical advice to rule out the possibility of colon cancer or any other serious underlying conditions. When weight loss is persistent or accompanied by other concerning symptoms, prompt action is necessary. If you are losing weight unexpectedly and have noticed other symptoms such as abdominal discomfort, changes in bowel habits, or fatigue, don't wait for the situation to resolve on its own. Seeking medical help early can lead to faster diagnosis and better treatment outcomes. Colon cancer is more treatable when detected early, and catching it in its early stages can significantly improve the chances of survival. So always be mindful of your body's changes, and don't hesitate to reach out to a healthcare professional if you notice any unexplained weight loss. 4. Constant fatigue and weakness. Constant fatigue and weakness are common, nonspecific symptoms that can be seen in a variety of conditions, but when these symptoms are persistent and unexplained, they may indicate a more serious health issue, such as colon cancer. Fatigue refers to a deep, persistent feeling of tiredness that is not relieved by sleep or rest. In the case of colon cancer, fatigue can significantly impact an individual's daily activities and quality of life. Weakness, on the other hand, is characterized by a lack of physical strength, which can make it difficult for a person to perform normal tasks or even get out of bed in some cases. Fatigue is one of the most frequently reported symptoms in individuals with colon cancer, and it often appears early in the disease process. The fatigue associated with colon cancer is typically different from the normal tiredness that comes from physical exertion or lack of sleep. It is a profound and persistent exhaustion that doesn't seem to improve with rest. This type of fatigue can be debilitating, affecting not only physical energy but also mental clarity, making it difficult to concentrate or focus on day-to-day tasks. It's important to note that this fatigue is often a result of the body's ongoing fight against the cancer, the side effects of tumor growth, or even the body's reaction to the inflammation caused by the tumor. One of the main reasons for fatigue in colon cancer is the loss of blood caused by internal bleeding. Colon cancer tumors, particularly those located in the rectum or lower parts of the colon, may bleed internally, often in small amounts that are not immediately noticeable. Over time, however, this gradual blood loss can lead to anemia, a condition in which the body doesn't have enough healthy red blood cells to carry oxygen to tissues and organs. Anemia can cause tiredness, weakness, and shortness of breath, further compounding the fatigue. This kind of fatigue is not just due to a lack of energy, but can also be a direct result of the body's struggle to get the oxygen it needs due to a reduced number of red blood cells. In addition to blood loss and anemia, the cancer itself can disrupt normal bodily functions, contributing to feelings of fatigue. As tumors grow, they can place pressure on nearby organs and tissues, impairing digestion and nutrient absorption. If the body is unable to absorb enough essential nutrients from food, it will not have the energy required for normal functioning. This results in a gradual depletion of energy stores, leaving individuals feeling more and more exhausted as the cancer progresses. In cases where the colon cancer has caused a blockage in the intestines, obstruction can prevent food from moving through the digestive tract properly, exacerbating nutrient deficiencies and increasing fatigue. Furthermore, the body's immune system can play a role in fatigue. The presence of cancer can trigger an immune response, which often leads to an inflammatory state in the body. Chronic inflammation can cause a feeling of general malaise or being unwell, which can contribute to both fatigue and weakness. This immune response, while a sign of the body's attempt to fight the cancer, can also take a significant toll on the individual's energy levels, leaving them feeling physically drained even if they are resting. Another factor contributing to fatigue in colon cancer patients is the psychological impact of dealing with an illness. The stress, anxiety, and emotional strain of living with cancer can cause mental fatigue as well, leading to feelings of hopelessness or depression. This type of fatigue may not be as physically debilitating, but it can still affect a person's overall well-being and contribute to the sense of weakness and tiredness. Fatigue related to colon cancer often becomes more pronounced as the disease progresses. It's also important to recognize that fatigue can be gradual and may worsen over time, making it difficult for people to recognize it as an early sign of cancer. Individuals may chalk it up to aging, stress, or lifestyle factors, but if fatigue is persistent and occurs alongside other symptoms such as weight loss, changes in bowel habits, or abdominal pain, it should be addressed by a healthcare professional. If you experience persistent fatigue that doesn't improve with rest, especially if it is accompanied by other symptoms like abdominal discomfort, unexplained weight loss, or blood in the stool, you should seek medical attention immediately. A doctor may run tests such as blood work to check for anemia or infection, and imaging studies to assess for potential tumors in the colon. Early detection of colon cancer is crucial because the earlier the cancer is diagnosed, the easier it is to treat and the better the overall prognosis. 5. Abdominal pain or cramps. Abdominal pain or cramps are common symptoms that can be caused by a wide variety of conditions, from minor digestive issues like indigestion to more serious conditions such as colon cancer. While occasional discomfort in the abdomen is normal, especially after eating a large meal or experiencing stress, persistent abdominal pain or cramps should never be ignored, especially if the pain is severe or occurs regularly. In the case of colon cancer, abdominal pain often arises as the tumor grows and causes a variety of changes and blockages in the digestive system. Abdominal pain caused by colon cancer can present in different ways, depending on the tumor's location and size. The pain may be sharp, dull, cramping, or even constant, and it may occur in specific areas of the abdomen or throughout the entire region. People with colon cancer may experience discomfort in the lower abdomen, side of the stomach, or sometimes even the upper abdomen. The pain may be intermittent, coming and going in waves, or it may become more persistent as the cancer progresses. The pain often results from a tumor obstructing the normal flow of waste, causing a backup in the intestines. When a tumor partially or completely blocks the colon, it prevents stool, gas, and digestive contents from passing normally, leading to distension, bloating, and cramping. The increased pressure in the intestines causes sharp or cramping pain, which can vary in intensity. Individuals may also experience nausea, bloating, and an uncomfortable feeling of fullness. Some people describe the pain as similar to severe gas pains or cramps that occur before or during menstruation. As the blockage worsens, the pain may become more intense and frequent, often making it difficult to find relief. In some cases, the pain may be a result of the tumor's invasion into surrounding tissues or organs. As the cancer spreads, it can irritate the lining of the abdomen and cause inflammation. This leads to a feeling of soreness or tenderness in the affected area. Additionally, colon cancer may cause ulcerations or lesions in the colon lining, which can also lead to discomfort and pain when food or stool passes over the affected areas. As the cancer grows, it can also cause changes in bowel movements, such as diarrhea, constipation, or a narrowing of the stool. This can add to the discomfort in the abdomen and further complicate the pain. For example, when the tumor causes narrowing of the colon, often referred to as a stricture, the stool becomes thinner and bowel movements become more difficult and painful. This pain may also be accompanied by gas and bloating, as the digestive system struggles to move waste through the intestines. The presence of abdominal pain or cramping, especially if it lasts for weeks or worsens over time, can be an early warning sign of colon cancer. In the early stages, the pain may be mild or intermittent, often leading individuals to dismiss it as something temporary. However, as the cancer progresses and the tumor grows larger, the pain becomes more pronounced and frequent. If you experience unexplained abdominal pain, particularly if it is associated with other symptoms such as unexplained weight loss, blood in the stool, or changes in bowel habits, it is critical to seek medical attention as soon as possible. Abdominal pain is not always a clear-cut indicator of colon cancer, as it can be caused by a variety of other conditions. Some common non-cancerous causes of abdominal pain include gastritis, gastroesophageal reflux disease, GERD, irritable bowel syndrome, IBS, gallstones, or constipation. However, if the pain is persistent, severe, or accompanied by concerning symptoms, it is important to rule out more serious conditions like colon cancer. Diagnosing the cause of abdominal pain typically involves a thorough medical history, a physical examination, and possibly additional tests, such as a colonoscopy, CT scan, or ultrasound. These tests can help identify any abnormalities or tumors in the colon or surrounding areas. Early detection of colon cancer is crucial for successful treatment, and catching it in the early stages can significantly improve the chances of remission and recovery. If you experience persistent abdominal pain that doesn't go away or seems to worsen over time, particularly if it's combined with other symptoms like changes in bowel habits or rectal bleeding, it's essential to see a healthcare provider right away. Colon cancer is more treatable when caught early, and seeking medical advice promptly can make a significant difference in the outcome. Don't ignore persistent abdominal discomfort, as early intervention can save lives. 6. Feeling like you still need to go, tennis match. Tenesmus, the feeling of constantly needing to have a bowel movement even after you've just gone, is a less commonly discussed but significant symptom of colon cancer. It is a sensation of incomplete evacuation, where the person feels a persistent urge to pass stool but is unable to do so. This feeling can be both uncomfortable and distressing, and when it occurs alongside other symptoms such as changes in bowel habits, blood in the stool, or abdominal discomfort, it could indicate something more serious, like colon cancer. Tenesmus typically occurs when the colon or rectum is affected by a tumor or inflammation. When cancerous tumors develop in or near the lower parts of the colon or the rectum, they can block or narrow the normal passageway through which stool passes. As a result, the bowel is unable to fully evacuate, even after a bowel movement, leading to a persistent feeling of needing to go. The sensation can be most pronounced after a bowel movement, but in some cases it may be constant or occur with little or no stool being passed at all. This feeling of incomplete evacuation can be frustrating and often leads to straining, discomfort, and anxiety about future bowel movements. One of the primary causes of tenesmus in colon cancer is tumor-induced obstruction. As the tumor grows, it can partially block the colon or rectum, preventing normal bowel function. The body may send signals to the brain that it still needs to relieve itself, despite the fact that no more stool can pass due to the obstruction. This often leads to a sense of urgency and repeated trips to the bathroom, even though little or no stool is produced. The irritation or pressure caused by the tumor can also lead to increased sensitivity in the bowel, further contributing to the feeling of needing to defecate. This sensation can be accompanied by other symptoms, including abdominal cramping, bloody stools, or a feeling of fullness or bloating in the lower abdomen. In advanced cases of colon cancer, tenesmus may become more severe and persistent as the tumor grows, causing even more discomfort and difficulty in bowel movement. Another possible cause of tenesmus in colon cancer is inflammation. As a tumor irritates the lining of the intestines, it can cause the tissues to become inflamed. This inflammation can trigger the sensation of urgency, even when there is little or no stool left in the colon. This can be especially common in rectal cancer, where tumors located in the rectum may directly affect the sensitive nerves and tissues that control bowel movements. The feeling of tenesmus can be similar to symptoms of irritable bowel syndrome, IBS, where individuals experience frequent urges to use the bathroom, along with abdominal discomfort. However, tenesmus caused by colon cancer is typically more persistent, severe, and is often associated with other warning signs of cancer, such as blood in the stool, unexplained weight loss, and changes in bowel habits, such as diarrhea or constipation. If you experience tenesmus in combination with these other symptoms, it is crucial to consult a doctor promptly. In some cases, tenesmus can also be a result of rectal infections, inflammatory bowel disease, IBD, or other gastrointestinal disorders. However, when the sensation of needing to go is accompanied by visible blood or a persistent change in stool appearance, for example, narrow or pencil-thin stools, colon cancer should be suspected. The development of tenesmus, especially when it occurs suddenly or without any clear cause, should never be dismissed as normal. 7. The iron deficiency anemia. Iron deficiency anemia is a condition where the body lacks enough iron to produce healthy red blood cells, leading to reduced oxygen delivery to tissues and organs. This can cause symptoms like fatigue, weakness, shortness of breath, and dizziness. While iron deficiency anemia can result from various causes, it is a common and often overlooked symptom of colon cancer, often due to chronic blood loss from tumors in the colon or rectum. In colon cancer, tumors can cause internal bleeding, often in small, gradual amounts that aren't immediately visible in the stool. This blood loss over time depletes the body's iron stores, as iron is a key component of red blood cells. As a result, individuals may develop anemia without being aware of the source of blood loss. The bleeding might not be noticeable at first, but as it continues, the symptoms of iron deficiency anemia can become more pronounced. Iron deficiency anemia typically develops gradually. Early symptoms might include mild fatigue, weakness, or pallor. As the condition progresses, individuals may experience more severe symptoms like dizziness, shortness of breath, and cold hands and feet. Physical exertion may become more difficult, and some people may even experience chest pain or headaches. This is because the body's ability to deliver oxygen to organs and tissues is impaired when there aren't enough red blood cells. The connection between colon cancer and iron deficiency anemia is primarily due to chronic internal bleeding. Even small amounts of blood loss over time can lead to a depletion of iron stores in the body. This can go unnoticed unless specific tests like a fecal occult blood test or blood tests are conducted. Colon cancer can also interfere with nutrient absorption in the intestines, further exacerbating the iron deficiency. Tumors or blockages in the colon can make it difficult for the body to absorb iron from food, even if iron-rich foods are consumed. If you experience unexplained fatigue, weakness, or other symptoms of anemia, especially if accompanied by gastrointestinal issues such as changes in bowel habits, blood in the stool, or abdominal pain, it's essential to seek medical attention. Your doctor will likely perform blood tests to assess your iron levels and may order a colonoscopy to check for any tumors or abnormalities in the colon. Early detection of colon cancer is crucial for improving treatment outcomes, and treating the underlying cancer is key to resolving the anemia. In the case of iron deficiency anemia caused by colon cancer, treatment typically involves both managing the anemia and addressing the cancer itself. Iron supplements can help restore iron levels, and dietary changes can increase iron intake from foods like red meat, beans, and leafy greens. However, without treating the cancer, the anemia is likely to persist or worsen. Treatment for colon cancer may involve surgery, chemotherapy, or radiation therapy, depending on the stage and severity of the disease.